The purpose of this study is to find a better treatment for patients who have myelofibrosis. As many patients know, there's one FDA-approved drug, which is the drug Ruxolitinib for patients with primary myelofibrosis. And in many patients, they have a suboptimal response. And in those patients, adding a second drug may really improve their quality of life and their ability to feel better with primary myelofibrosis. So trying to find drugs that we can add to Ruxolitinib to improve the response and potentially move towards a curative therapy is the aim of this trial. The second drug is a drug I'm pretty excited about. It's called Navitoclax, which is a big word, but this is a drug that actually works along with Ruxolitinib in a cell to promote the death of an MPN cell or the MPN cancer cell to try and make it disappear. Navitoclax as a drug, just like Ruxolitinib, it is an oral agent. And this is a drug that you can take at home. The first day that you would take the drug, it would be in the clinic, and we are always watching your laboratory values after you take a new drug to make sure that you tolerate it well. The goal of this study is to add a second drug to try and improve the overall efficacy of their response. Ruxolitinib is the only FDA-approved therapy. For some patients, this works very well. It's not curative in any patient, and the duration of response is still really unknown. Some patients actually stop responding to the drug. You have to be an adult, which means you have to be age 18 or over. You need a diagnosis of primary myelofibrosis or post-ET or post-PV myelofibrosis. At the time that you are planning to enroll in this trial, you either feel you don't want to go forward and have a transplant or you're not able to go forward. You have to have been on Ruxolitinib for at least 24 weeks and be on a stable dose of that drug before enrolling on this trial. And you must have an enlarged spleen to be eligible for this trial. One of the more interesting things about this trial is instead of targeting a specific dose, this is the dose that we're going to use, and whether it's the right dose for you or not the right dose for you, that's the drug which they've stipulated on the clinical trial. One of the nicest things about this trial is that the dose of Navitoclax is actually tailored directly to your response to the drug. For example, if it only takes a little bit of drug to make a significant difference in how you feel with your MPN, that's all you're going to get. But if you need a higher dose, we're able to do that. The way we will measure the response to this drug is to see, first of all, how are you feeling? Are you feeling any better or not better? We'll look at your blood counts to see if they're improving. And we look at your spleen size to see whether or not it's getting smaller. And the drug will be titrated to those things. I think that patients with MPNs really are looking for new drugs to help them feel better, to help them avoid transplant, and to help them to live more normal lives. We are really hoping that combining Navitoclax with Ruxolitinib will improve the response of MPN patients to these drugs, and that we will be able to improve the quality of life of patients who have MPNs. MPN patients are a very motivated group of patients who often jump at the chance of trying new drugs and helping us to move the field forward so that we might be able to come up with therapies that are more tolerable and more efficacious for their disease.